in health and healthcare. I'm thrilled to have you join us today. And if you're so inclined, please feel free to click the share icon at the bottom of your screen to share this important conversation with your network. We want to give everyone the opportunity to join in and benefit from hearing leaders discuss health equity and belonging. And at the end, we'll leave time for some questions. So feel free to post your questions as we're moving along, and then we'll answer them towards the end. Today's conversation is about allyship. An ally is defined as a person that actively promotes and aspires to advance the culture of inclusion through intentional, positive, and conscious efforts that benefit people as a whole. I recently read this quote: "White male allies exist in all walks of life, but it's the ones who move beyond the basic status of passive ally and evolve into intentional accomplices and conscious co-conspirators that influence the most meaningful change." These suggestions are applicable to white people of all genders, of course, but I've chosen to speak to white men today because they occupy 86% of Fortune 500 CEO positions and a seat of power that can have a major influence in creating equity and inclusive environments. Now I'd like to introduce today's guest, my dear friend, Josh Willeford. Josh has over 2 decades of mission-driven healthcare finance leadership experience, and he is the current chief financial officer of a company called Osso VR, a virtual reality surgical training and assessment platform. Prior to joining Osso VR, Josh spent about 10 years, in the healthcare environment, and he was previously the chief financial officer for a venture-backed company called Groups Recover Together, an outpatient opioid addiction treatment program that helps members find community, beat addiction, and get their lives back. Josh spent nearly a decade as a consulting executive with the advisory board company and Optum, where he led consulting engagements designed to provide a holistic view of the integrated care delivery system. He holds an MA from the University of Tennessee and a BS from Lipscomb University. Welcome, Josh Willeford.
Duane, it's a pleasure to be with you today. Thanks for having me on.
Absolutely. Thank you for joining me. We've had certainly a long-standing friendship, and it is great to have someone that I know is an ally and in the corner of all types of individuals in the workplace and outside of the workplace. So I'd like to start by asking, can you share a bit about your thoughts on allyship and really why it's important in creating inclusive environments?
Absolutely. So before I dive into that question, Duane, I want to start with 2 things. So first, this is a lesson that you and I saw play out from our dear friend and colleague, Dr. Alan Lassiter. And what we saw Alan do time and time again is truly live out the principle that gratitude is the healthiest of all human emotions. Yes. And so I just want to start by saying how grateful I am to be with you here today. You're one of the most thoughtful, compassionate, and driven colleagues I've ever had the privilege of working with. And I've got to say, seeing you and your team chase your passions together is both encouraging and inspiring. And I'm very grateful to be with you on this journey. Secondly, and I can't stress this enough, I want to be abundantly clear that by agreeing to chat with the chief today, I did not agree to hold myself up as any sort of an expert here on the topics we're about to discuss. I'm here to learn, I'm here to listen, I'm here to make mistakes, and I'm here to grow. We're going to hit on some pretty uncomfortable topics, and I've got to be honest, they're especially uncomfortable for a straight white Protestant male like myself, and I think it's okay to call that out here at the beginning. Sometimes it's uncomfortable to hold the mirror up, but it's something that we absolutely have to do if we're going to create a better, more inclusive world for our children and for generations to come. That said, I'm here for it, man. All the discomfort.
Well, Josh, thank you for the kind words. And quite frankly, I'm grateful to have you here. And the reality is, from my standpoint, you actually are an expert because you've put yourself in the space. And part of, I think, making and formulating more inclusive environments is really about white males participating in this process and feeling like they are just as much accountable for the change as the rest of us. So really do appreciate you being here, and definitely interested in learning more about what you feel allyship is about and why it's important in creating an inclusive environment.
Absolutely. So I got all the precursors out of the way. Now I'll actually try to answer the question that you asked me. So look, my thoughts on allyship are simply that it's a journey. I'm such a firm believer in seeking first to understand and then to be understood. And I've got to be honest, that philosophy has really served me well across my career as it relates to allyship. I know that I personally learned so much from people who don't look like me and people that have different life experiences from me. And I'm just a firm believer in always trying to walk a mile in someone else's shoes. And you know what? You can't do that unless you do a whole lot more listening than talking. To be an ally, you have to listen with the intent to understand. And so I think that's a really important principle as it relates to allyship. And I've just got to say, I believe wholeheartedly that inclusive environments and uncomfortable conversations really do serve us well in advancing true allyship, so that we can, really embrace diversity as the strength that it's meant to be.
Yeah. Well, I think you're right. It's really about understanding one another. So listening on both sides is important, but as an ally, you certainly have to be able to almost take on the struggle and the circumstance of underprivileged, marginalized groups as your own, and really fight furiously to help create an environment that incorporates and is a space of belonging for those individuals. And I think, so many people really do aspire to be allies, but some admittedly struggle with the courage to challenge the status quo. And so what I'd like you to do, if you're able, is to share a time where you might have been hesitant in your journey, but you pushed through that fear because you really knew it was the right thing to do as an ally.
Absolutely. So I'm going to provide some thoughts on that question, and you can accuse me of not directly answering the question at the end if you want to, but this is kind of what I want to say on the topic. Duane, my mother was a social worker, and my father, who you got to meet in LA, was a special education teacher when I was growing up. So all my parents did every day was stand up for the marginalized. I had such a wonderful example. And, I always wanted to be the kind of person that would sit in the cafeteria next to the kid with no friends. I look back and I regret not doing so much more of that because I certainly didn't always get it right. And my approach now is that I'm really doing my best to instill that into my kids and to model that for my friends and colleagues. I've done that in a variety of ways, or I should say I've tried to do that in a variety of ways. But, Duane, as I was thinking about the answer to this question, one idea just kept popping into my head. And that idea was just shut up. So, what I find myself doing is making sure that the marginalized around me get the floor regularly. Here's what I mean. So we obviously live in a really Zoom-centric society right now. There's a ton of what we're doing right now. And I'm certainly not batting 1,000 on this by any means, but I really do my best to cede the floor when I start talking at the same time as someone else, and especially if that person is a person of color or a female. I've always believed that you hire good, trustworthy, talented people, and then you do your best to just get out of their way. This is one really practical way that I try to do that by ceding the floor. So Duane, Renee talked last month about being intentional, and she talked about the power of the nudge. By the way, Renee, if you're listening, you are an impossible act to follow. That was such a wonderful and enriching interview, and I certainly enjoyed it and benefited from it, and I'm sure everybody that's watched it has as well. But as I think back to nudges in my career, I think about encouraging female colleagues and colleagues of color to speak up. I think about recommending my female colleague, Sarah, for stretch projects and directing technical questions her way in big meetings, even when the easy thing to do would have been for me to answer the question myself.
Yeah.
I think about looking at Sarah or at Krista ahead of a big meeting and saying, right before we walk into the boardroom, this is your meeting, right? You've got this. Shortly after by the way, for those of you listening that don't know Krista Stepney, she's Duane's Chief Operating Officer, one of my all-time favorite colleagues and friends. She's wonderful in every way. And shortly after I had the privilege of starting to deliver consulting engagements with Krista at the advisory board, I started telling friends, colleagues, clients, whoever would listen, I'm sure Duane's heard me say this many times, that I'm going to work for her someday. By the way, I still believe that that's going to happen.
And I actually work for her today.
Absolutely, for sure. Duane, I've consistently tried to encourage female colleagues to take the microphone. And please don't hear this as me trying to take credit for anyone's success. That couldn't be further from the truth. Krista, Sarah, and my other fabulous female colleagues and colleagues of color deserve the success that they've earned. In fact, I'll tell one more story. I once had a female colleague who earned a promotion, and I had the privilege of delivering that news to her. After I delivered the news, as she was walking out of the room, she turned around and she said, "Thank you, Josh. I can't wait to tell my mom that you gave me a promotion." I said, "Stacy, come back in here, please, and have a seat." So she closed the door and she came back in, she sat down, and I looked her right in the eyes and I said, "Stacy, don't you dare tell your mother that I gave you a promotion. That is not at all what happened here. You call your mother and you tell her that you earned a promotion." Her smile got a little bit bigger and she kind of floated as she walked out of the room. Your question references challenging the status quo, Duane. And I've just got to say, it's really clear to me that the status quo is not working for marginalized communities. And for that reason, the status quo really isn't an option moving forward. So as I said, I'm focused on listening, I'm focused on learning, and I'm really focused on handing over the microphone whenever I possibly can.
I appreciate that. And I have bear witness to many of those stories and those nudges and points of encouragement that you've given, which is why I have you on the show today. When I think about the stories that you told, what I actually think about is servant leadership. And your ability to take your position of influence, of power, and serve others through that. And that act actually creates an environment of belonging and inclusivity and really raises up those traditionally marginalized groups that may not have positions of power or may have struggled throughout their career to really fight against some of the harassment, discrimination, microaggressions that people experience. So I applaud you for doing really what is good leadership, is servant leadership in the name of creating an environment of inclusivity and raising others up. That to me is what allyship really is about. So I want to shift gears a little bit, because as you know, my company is squarely focused on moving health equity forward. And, health equity is a topic that you and I have had a lot of discussions on across the years. And a research study conducted actually found that we waste as much as $57.5 billion annually on direct care disparities. And if you think about it, the margins in healthcare are slim, and they've gotten that much more slim through the COVID-19 pandemic. And we've been searching for ways to be more cost effective, but also create better outcomes. Despite these conditions in health care organizations, I wouldn't say that health equity has been systemically quantified and has systemically understood the cost of disparities and the dollars that we could actually recover by closing disparities gaps. So as a CFO and someone who has consulted on healthcare financial performance, why do you think we've not treated this as we would any other opportunities for financial improvement?
Duane, there is so much there with that question. I'm going to attempt to unpack a portion of it, I'll do the best I can here. The truth is, I really wish we had a better answer for this question, and shame on the financial community, myself included, for not having a better answer to this. I honestly think that so many CFOs out there are analytical, type A's, and this topic really falls into the kind of touchy feely, scary, unknown bucket for them. And we just don't really have a good answer for that. Unfortunately, I think this topic is a really good example of the easy action versus the right action. The easiest thing to do in life is almost always nothing at all. I said earlier, I really believe that diversity is our strength, and it just makes so much sense to me, even as a CFO, that care quality, that employee retention, and a host of other metrics are always going to improve with representation. My personal approach to this has always been to really seek out organizations that value diversity, equity, and inclusion, and to really stay aligned with those goals by continuing to practice what we preach. My current CEO, Dr. Justin Barad, is such a wonderful example of this. And I'm proud to say that we have been aligned from day one on this topic. And to tell you the truth, it's not something that we've had to talk a ton about, because we just live it out in the way that we source candidates, the way that we hire, and ultimately the way that we operate our business day to day. I'm incredibly grateful to say that we are one of the most diverse workforces that I've ever been a part of. And we regularly get complimented on this. Duane, to be honest, it's not something that Justin or I feel particularly comfortable accepting praise for. But I do have to tell you, it is something that we've been incredibly intentional about. We simply know that it's the right thing to do. And we're going to continue to be intentional about diversity, about equity, about inclusion, because that's best for our colleagues, and ultimately it's best for our business. Duane, I have to pose this question back to you again, because it's such a meaty question, and I probably didn't touch 5% of it. But I know this is coming up so much in all the great work that you and your team are doing. And I think the audience would really benefit from hearing some of your thoughts on this topic as well.
Sure. So, number one, let me congratulate you and the Osso VR team and your intentionality around this. It really is about thinking very intentionally, but creating action behind those thoughts that brings diversity to the table, understanding that diversity, if harnessed appropriately when it's in the organization, can actually lead to much better financial performance. When I think about health equity in particular, I think about it from a population health perspective, and even from a care management perspective. So we know that there are high risk, medium risk, and low risk patients that come into a healthcare system. And those high risk patients are probably accounting for the lion's share of the costs. Whether that be through emergency room visits, through inpatient stays, through increase in length of stay, readmissions. There are dollars tied to that. And our organizations have figured out that we need to be paying attention to that. But the next level down, if you think about this, if you're looking at it like a financial statement, the profit and loss statement is going to give you a snapshot, but there are things beneath that that you need to understand in order to be able to pull different levers and change the revenue or expense picture. It's no different with health disparities. We can identify high, medium, low risk. Well, what about those groups might be getting in the way of them receiving the best quality care and the best outcomes and reducing costs? Well, it could be social determinants of health that are associated with a particular patient based off of where they live. We also know and now understand that racism is a public health crisis, and a person's race is a factor in how they receive care and the outcomes that they have. And so to me, it's a no-brainer to begin to look at this by disaggregating information, demographic information, so that you can really diagnose the root cause and hopefully close that gap, which ultimately leads to better financial performance for your organization. So you have got me on a soapbox here, but I think of this and see this as a business priority to solve that has moral implications.
Completely agree. And Duane, I'm looking at a couple of the items that are coming in the chat. First off, Jana, thank you so much for your participation. And I just want to clarify my comment. So you're saying that this is not a slippery or a touchy-feely topic, and I couldn't agree with you more. What I was trying to provide is perspective on why many CFOs may view it that way, even though I don't. So I've got to tell you, on the Myers-Briggs, there's thinking and feeling, and I score off the charts in the feeling direction, which is very rare for a chief financial officer, and maybe why I'm just a tad more comfortable talking about these subjects than others. But Jana, great point.
Yeah, and speaking to that, Josh, maybe a new competency for a CFO is actually empathy and understanding that perspective. And I know some great CFOs who get that full picture, but we need more of them to come forward and to really advocate for understanding and measuring health disparities and the impacts within the organization.
Absolutely, because there's real tangible benefits there.
Yeah. Well, Josh, last question I'm going to throw at you here. I know you have deep commitment to racial justice, and I'd like to understand what has led you to that commitment, and how are you engaging others in the dialogue and asking them to really use their privilege to create equity?
Duane, I love this question, and it's the right question. Two things before I dive into the answer. I'm a 6'7" straight white guy, and without a doubt, I have benefited from privilege in my life. That's not to say that everything in my life has been easy or pain-free by any means. It wasn't, but I've absolutely benefited from privilege. The second thing is, getting white male leaders to even acknowledge privilege is still at times an uphill battle. So I just wanted to kind of call that out before I answer. So all that said, Duane, you know that I have a black godson who I absolutely adore and who I would step in front of a bus for. He and my biological children have such a refreshing and healthy open dialogue. They spend tons of time together, and that open dialogue is about almost all things, but it's especially refreshing to hear them talk about issues of race together. Mm-hmm. My oldest biological son was heading out to a neighbor's house during the pandemic to shoot BB guns. He walked out my front door, he walked across my yard, across the neighborhood, across the street, carrying a BB gun. That evening, I was nearly brought to tears because I had to admit to myself that I would not have allowed my godson to do the same thing. If he were going to the neighbor's house, I would have put him, in the car, and we would have driven over to the neighbor's house. I would not have sent him across the neighborhood with a BB gun. Life's really unfair sometimes, and I hate that. I think as much as anybody. I really have no ability to comprehend, Duane, how someone in 2021 would think that there is anything less than about someone with a different skin color.
Mhm.
That said, I don't think it does any of us any good to bury our head in the sand and to pretend that George Floyd, Breonna Taylor, Ahmaud Arbery, and so many other tragedies didn't occur. I'm really doing my best, and consistently falling short, by the way, to engage in dialogues that make my friends and my colleagues really think about racial justice and really think about racial reconciliation. Sometimes it's as simple as saying, hey, do you think that you and, fill in the blank had the same opportunities in life? Do you think that you and fill in the blank had the same experiences in life? Those are always interesting questions to get answers to. And, it's especially interesting to me when the posture coming back is defensive.
Yeah.
I certainly don't have all the answers here, Duane. Gosh, I so wish I did. I wish somebody did, I should say.
Yeah.
I hope that I'm helping those around me. And I've got to say, especially those in a wealthy white bubble, which I find myself in quite often, see that the experiences aren't the same for our marginalized brothers and sisters. What I try to really enforce with my kids, with my friends, with my family, with my colleagues, and with my community is that you're fooling yourself if you believe that your reality is the reality. Yeah. You have to walk a mile in other people's shoes. You have to take a breath. And for the love, white male leaders, please listen with the intent to understand. It's going to make all the difference in the world.
Absolutely. And Josh, no one has all of the answers or even the right answers. We know some things to do to help move forward. And part of it is about listening to marginalized groups, believing them when they tell you what their experience is. But the important part is being in the battle with us, being a co-conspirator, being an ally. And I couldn't think of a better person to bring on the show and talk about allyship than you. And I think everybody, who's tuning in will recognize that. So I thank you very much for the ally that you've been to me, and for now teaching others how to be that same type of ally. So I'm going to open it up just for some questions. In the chat function, if you would like to ask a question, we'll certainly entertain those now. Okay. Well, Josh, doesn't look like many questions are coming in. Certainly, we have some folks who are expressing their appreciation for the conversation today. So what I'd like to do is just tell people a little bit about how they can find out more about you and about your company. They can visit OssoVR.com to learn about the Osso VR company, which is doing some pretty spectacular things in terms of virtual reality training. And I also want to thank the audience today. And certainly, if you can continue to join us for our chats with the Chief, a Belonging Dialogue, we will have these conversations once each month at the 12 p.m. hour. And certainly, if you are connected to me on LinkedIn or connected to the Just Health Collective site on LinkedIn, you'll see information about that. And please, if you can, bring others along. This really is about community, creating a space where we can have these dialogues, and certainly applying it then from the lens of my space, health equity, and belonging, because we are trying to create a more just and equitable healthcare system. So Josh, thank you so much. Thank you for coming and being a part of our conversation today.
It's truly been my pleasure, Duane. Thank you.